Welcome to Industry Ignited, the podcast where we spotlight leaders who are pushing the boundaries of innovation across industrial, manufacturing, and B2B sectors. I'm your host, Dr. Leeanne Aguilar. Today, we're taking a fascinating look at the intersection of biotechnology and industrial-scale manufacturing, how one company is transforming global health with science, process, and production. My guest is Chris Przybyszewski, President of U.S. Biologic, a company known for its bold mission, delivering disease prevention. U.S. Biologic develops groundbreaking orally delivered vaccines that make it possible to safely, effectively, and cost-efficiently deliver preventative interventions, not only to humans, but also to wildlife, companion animals, and livestock. Their approach embodies the One Health principle, recognizing that human health, animal health, and environmental health are all deeply interconnected. Chris brings extensive experience to building public-private partnerships, raising over $150 million for biotech initiatives, and leading innovations from early development to commercial delivery. Today, we'll explore how U.S. Biologic takes cutting-edge science, adapts it across species, scales it through modular manufacturing systems, and creates real-world disease prevention solutions that benefit industries and communities around the globe. Chris, welcome to Industry Ignited.
Well, thank you so much, Leanne. I appreciate you pulling me in.
Absolutely. Now, Chris, you've had a fascinating career journey, starting from building large-scale public-private programs to founding companies and now leading U.S. Biologic. Can you walk us through how your career path shaped your leadership style?
Yeah, certainly. I've been really lucky. I've been able to see a lot of different facets of the way that big programs are built, big technologies are built, big solutions are built. I started in research in neuroscience for about 6 years as an undergraduate, and then I moved over into actually the president's office of my university. And so I went immediately from this idea of how do you work at your lab station to how do you see an entire institution that has all sorts of sciences happening at once of all different varieties. I got to move over into public health after that, a much larger sphere than any single university, working with physicians, working with economists, working with sociologists, understanding the larger systems there and understanding how it is all these different groups have to talk to each other. I moved over from there into the medical device space, working with surgeons and with scientists and biomechanical engineers. And then I spent a bit of time in the high-tech space, the mobile device space, the big data space. And again, working with engineers, but then also working more and more with industry partners, businesses that actually use these technologies on, business to business or business to customer. And then in the infectious disease space, where it's been a combination of all these things coming together, because there's the public health piece. Most certainly there's the science and engineering piece. And as you say, there is in the manufacturing piece of being able to make these solutions happen. And all of that has really shaped me personally into a pretty good listener and someone who wants to translate, because some of the biggest challenges we will see are folks like a physician and a scientist. You think, well, they're both working on science and the body and a species, and they are, but they also speak very different languages, and their definitions are very different. What is efficacy? What is safety? What is a statistically significant result out of a study, right? And so I have learned, from my perspective as a leader, okay, let's first align on the goal. Let's understand what we're doing here, okay? And let's put it in language that everyone understands. What is that metric of success? And then you really do work with each of them along the way, constantly trying to bridge those gaps so they could work the best together, but at the same time keep on that goal and hopefully keep on schedule and in budget in order to get where it is you need to be. So really, everything that shaped me is just the amazing folks I've been able to work with and just trying to listen to them and learn from them.
Yeah, it's a fascinating journey across, the whole spectrum of, medical and business and the intersection of where it all comes together. And I like what you're saying about communication. I mean, tell me a little bit more about how you bridge that gap in communication when I guess for one, you first have to identify that there's a disconnect
Right.
when it comes
Yeah.
to people using similar terminology, but having different definitions. So tell me a little bit more about how you identify that and what you do to bridge that gap.
Yeah, I think it's partly just the training that we all undergo when we're in a specialized field. So much of science is about apprenticeship, working directly with a scientist and working with, specialized language in terms of what are these systems called and our acronyms and, what are these, how is it that you say these specific chemical names and that sort of thing. With physicians, they go through internships, they go through residencies, they go through the fellowships. It's very much a hands-on apprenticeship approach as well. And so they are in many ways very siloed. And then think about what their days are like. When you're looking at a scientist, they are looking at months and months just to get a single result, right? Because biology takes time, and it takes a lot of patience and a lot of trial and error. Does a surgeon have that much time? No, they don't. They have maybe seconds. They have to make decisions and they have to live with what happens,
right.
And they have to fix it on the other hand. So I think a lot of it is, you'll say, okay, person A, what I'm hearing you say is this. Is this correct? Is that the right summary? Okay, person B, what I'm hearing you say is this. This isn't a new technique, right? I don't want to call it couples therapy, but there are similarities to some aspects of it. And then you just have a lot of conversations to keep moving forward, and you remind each other where this is. And I don't mean to make it sound just like physicians and medical. Sometimes it's the regulatory crew talking to the accounting crew, right? The regulatory group says, well, we have these systems and this reporting and this chain of evidence, and it has to be documented in a very certain way. The accounting folks, well, we have this system of evidence and chain of reporting, and it has to be documented in a very certain way. They don't realize that both of the worlds are very complicated, very sophisticated, very demanding, and they just don't think the other group have to deal with those same things. So sometimes we sit down and say, what does gap actually mean? What does that mean to you? and just keep talking that through over and over again. I'll be honest with you. If you're working with folks who are just okay with who want to communicate, who want to get to that point, it's going to be okay. There will be frustration. It'll be far more frustrating if it's in a vacuum where all they hear is the same thing to themselves and they just assume what other people are thinking. Right? So that's where you do have to bring it in and just get people to talk one-on-one about what that specific issue is and just keep building that culture.
Well, and I've seen even within the same industry, there can be one acronym that means different things. And so, depending on if it's a like accounting acronym or a technical acronym. So, right. So communication has to be very specific. And I think listening and reiterating, like you said, it's not a new technique, but it has to be intentional.
It still works.
It does, right. You've raised significant funding and worked with investors, government, and scientific partners. What lessons have you learned about bridging the worlds of science, business, and policy?
The thing that surprised me the most when I was able to do it for a bit was how limited a lot of funders are and how much help they really do need to be successful. A venture capital company generally has a very rigid thesis. We will only invest in companies that do A, B, C, and meet these criteria. A government agency actually has a federal mandate, right? I mean, the legislator has to tell them how to fund things and what to fund. Foundations frequently will have the same thing, so when you're looking at public, private, industrial. And so in that case, by the way, much less how much of a budget they have to spend, right? That's also very rigid. And you have to find that alignment. You have to find a way to help them understand how you are not only meeting their criteria, but you're doing it in such a superior way that really does help them feel like they're accomplishing their own mission, right? And we have to acknowledge, their goals are very different. A venture capitalist company goal at the end of the day is ROI, right? They have to have a return on investment to their limited partners in order to get more funding, in order to reinvest, in order to help more companies, okay? This isn't an evil thing. They're trying to build companies that are doing good things. But in order to do that, they must have that return on investment, okay? When you are talking to, however, a government agency, right, it's very different. The ROI for them is the metrics of success. Have you done their objectives? Okay. But on the other hand, remember what their goal is: to show success, to go back to Congress. Here's our success, and then procure more funding, right, through appropriations in order to do better things. So even though their goals are the same, at the end of the day, the ROI is very different, and the way to achieve that is very different. So it's a matter of really working together and talking and using what little access you have to those groups as efficiently as possible. I've never written a grant proposal. Well, I haven't for a long time. I got burned really badly once until I talked to the program manager, right? I really want to talk to him. I want to say, hey, here's our idea within 2 sentences. Is just, don't tell me if I'm going to get the money or not. Just tell me if this fits your scope. Does this fit into what you, and frequently you'll get a good answer, maybe not the answer you want to hear, but you'll get a good one. You just want to try to talk to them and make sure you're getting to what they need and make that happen. And that's where it goes. And that's no different in a lot of fundraising, I don't think. I think even if you're looking at the nonprofit world and you're looking at major development, you have to know what that donor needs. What is that they're looking for? What is that ROI? Tax benefit, sure. But really what makes them feel like they're spending their money in the right way? And so it's a common theme, even though, again, the languages are very different, the people are very different, their ROI concepts are very different, and the pathway are very different. It's still the same idea. Just talk to them, figure out what they need.
Yeah. So what kind of access do you have to the different venture capitalists or government entities as far as presenting your ideas or making sure there's that alignment? Because I know a lot of times they just put out a scope and they have, these paperwork and certain requirements that you have to, check the boxes off of. So how do you get in front of them to discover that?
It's sometimes a very indirect way. I mean, sometimes it's a matter of just saying, hey, look, I don't have an intention of applying to your program. I'm talking about a government policy. I just want to know what you're doing, right? And talking to them. A lot of it is talking to your peers. What'd you get funded? What worked for you? It's a good question. The NIH, for example, also has a very robust reporting platform that they'll say, hey, here's what's been reported, overall. And so access is limited, and you can't be too mercantile about it. You have to build a relationship, and that relationship can't be a quid pro quo. It can't be a, let's have this relationship just so I get something out of it. It has to be something just informational where you're doing this sort of thing on the public sphere. The private sphere with the venture capital companies, it's a bit different, I think. I think it's really just about access and bringing them things that are interesting and useful and having a bit more of an open conversation. You don't have as many conflicts of interest with a venture capital company that you would in a public sphere, which is understandable, right? The people in the public sphere cannot, by design, gain personally, mostly monetarily, from the things they're doing, right? So that's a conflict of interest that you can't bring to them. Venture capital companies, that's their gig, right? I mean, that's what they're doing. And so I find that is a little bit different. I will tell you this in both cases: you cannot waste their time. This is not a, hey, how you doing? How's life? How are the kids? I mean, that might be a part of it, but I mean, you have to bring them something of interest, an interesting question, a relevant question to what everyone thinks about all day. And so you really have to use their time very wisely, or else they won't talk to you again. You're a waste of time. They have too many things to do all day long. And that should be a pretty good pressure in the back of your head. Why is this conversation valuable to the person I'm talking to?
Yeah, I get that. So your favorite quote, "I shall either find a way or make one," really embodies perseverance. How has that mindset influenced your decisions during tough moments?
That's a great question. I appreciate you asking that. It is a very important quote to me. It's actually on my college campus is where I first saw it, and I was just visiting the campus. And it's on a gateway, 1893 memorial class gate. It's a quote from Hannibal from the Second Punic War. They're like, okay, Hannibal, we got these Alps, and Rome's on the other side. We can't do this. We can't take our army this way. We have elephants, man. What are you talking about? And Hannibal was just very clear. He's like, can't come from the south. Everybody does that. They lose. Guys, this is happening. This is going to happen. We're going to find a way, or we are going to make one. And what really caught me was that it's kind of it's immutable, right? Well, we can't find a way. Fine, make one. Well, we can't make one. Well, okay, well, let's go find one. And it's one of those things that if you have made that decision, if this is what your goal is, then this is going to be the attitude you take, or you will fail. And what I really like about it also is that it basically says, it's a very definition, well, this goal is achievable. If you're going to make this your case, you have to be able to say this goal can happen. Crossing the Alps, ending world hunger, peace, all those other things. No one says it's easy, right? No one says it's going to be done tomorrow. No one ever said that it's going to be done in one step. But it is possible, and we're going to find a way, or we're going to make one. And as I learned more about that quote, one thing was really striking to me was just that's class of 1893. And you think, well, they only had one shot to say something for a memorial gate that's big. You don't get to say too much. And I looked around, what has happened in 1893? You had a major stock market crash. You had a big stock market crash. But at the same time, you actually had the World Columbian Fair in Chicago. Tesla was there, and Edison was there, and the Ferris wheel was there. You had this, and millions of people went to it. And so you have this juxtaposition of what seems to be a really awful financial time, right? Maybe I'm making analogies to today's world, though it's not as bad now. But at the same time, you had these really world-breaking events, this idea of electricity, being brought up. So I can see this group sitting around and thinking about it a little bit, going, yeah, this seems like an impossible time, but people are doing great things. And this quote does say something to it. So from my perspective then, just to round it back to your actual question, I ask a simple question, is this something that is that important? Is this something that has to happen in my point of view, right? And if that's the case, then you put the target up and you say, that's it, that's going to happen. We'll find a way, or we will make one. And so that makes the decision making very important, of course, about what that goal is. And sometimes it might change. It happens. This is real life. But it does make it very clear that this is going to be a thing. And everybody else should just get in line with that. And we need to do the things we have to do to get there.
To drive innovation. It reminds me of Henry Ford's approach and his perseverance in developing the automobile, and just not taking no for an answer from his engineers. It didn't matter how long it took or how many resources, but there was a way, and he wasn't going to take no for an answer, and he got the yes, eventually. Eventually. Yeah.
In science, you sometimes do say, I didn't ask if it was hard, I asked if it was possible. Right. And, then you hear theoretically, yeah, but it'll take this much time and money. And then you say, okay, good. Now we're having the right conversation, because as the leader, it's my job to get you those resources and time in order for you to do these amazing things, and to change the world with what you're doing. Do I always succeed? Certainly not.
Right.
Most certainly not. Failure is a big part of innovation. It's a big, important part of innovation. But on the other hand, it's the same idea. It's just the goal is possible. Okay, fine. We'll find a way, or we'll make one.
Right.
And we'll
don't let failure stop you. And
that's right.
Yeah,
that's right.
that
It's
mindset.
irrelevant. It's absolutely relevant.
It's
Build
irrelevant.
off of it, actually.
Yeah, it's needed. Exactly. You learn from it.
Yeah.
Yeah. U.S. Biologic focuses on orally delivered vaccines, which is a game-changing approach. For those unfamiliar, can you explain what sets this technology apart from traditional vaccines?
Sure. We've had very few oral vaccines. The ones that have worked have been remarkable. Polio vaccine, is a good example. In the animal health world, zoonotic diseases where animals get us sick, there's been an oral rabies vaccine program that's been very, very successful. Generally they're limited though because they're these live viruses, which is just not great to put into people or into the environment. It's very limited use and only under extreme duress. And I would suggest polio and rabies are great duress. They're very dangerous diseases. And so U.S. Biologic had a commentary then internally in saying, well, we have this real big problem, Lyme disease, and everything we do about Lyme disease is not working. In fact, Lyme disease has exploded. It is 500,000 people in the U.S. every year. And we said a human vaccine doesn't exist, probably won't for a while, and the human vaccines that are in development, we don't think are, we think they have challenges. There's some dog vaccines, but that doesn't really move the needle in terms of how Lyme is. And we said, okay, well, where does Lyme disease start? And it starts in mice and ticks. So ticks give us Lyme disease, but it's usually started in feeding on already infected mice. Okay, if that's the case, if that's the actual issue, then could we vaccinate a mouse? Yeah, we know people have done that tens of thousands of times. If they're, any research usually is in those mice, right? So they know all about how to vaccinate those mice. Okay, but what about vaccinating mice in the field? That was the question. How do you get to that many mice in a backyard? What criteria must you set in order to make this a reality, right? There are a lot of them, right? Thermostability is probably on the top of the list. Our CSO, our Chief Scientific Officer, Dr. Julika van Oosterwijk, reminds people that mice don't run around with -80 freezers on their back in your backyard, right? So you have to have something that is able to withstand normal environments, but that includes both in the snow and the temperature-wise, winters and summers. So that was the first thing. The second thing is safety. The oral rabies vaccine is accepted because it's not put near humans. It's put way out in the woods because those are bigger animals. Coyotes are chief among them, raccoons, so they can put them out by airdrop into the deep woods, never come near a human. Well, most of Lyme disease is in your backyard. That's where about 75% of the time that it happens. And if that's the case, you're going to have something that can go near where people are. And that means that you have to go where the pets are, right? And that sort of thing. So you had to find something that was very safe. In our case then, we had to find a way to make a vaccine, make it thermostable, but then at the same time, whereas most vaccines have live or attenuated, or they have RNA, or they have viruses, we had to come up with a dead protein, just a simple dead protein that would sit on this feeding system, and it had to be able to get out into the wild and still be quite efficacious for the mice. And that's the third thing, right? So thermostable, safe, has to work, and then you had to have an issue of that animal itself, right? What was our target animal? It was the mouse. Okay, good. Now you need something that is edible in a way that a mouse eats it, right? In our case, what do mice eat a lot? Acorns, right? And so they had to hold on to it, and they eat it from the outside and the outside in. It has to be small enough that, and by the way, it can't be nutritious. We don't want to feed the mice. That's not interesting. So we had to have that as the next criteria. And so, okay, fine, you have a pellet. Okay, you can't cook a pellet, right, with this vaccine in it. It'll destroy it. You put it in an oven. Most things in ovens get destroyed. So then we had to spray it on, which means that we now had to figure out how to create a spray-on system to get this onto these pellets. And we had to rebuild an entire spray structure that was used in the food industry in order to be good on these little pellets, such a way that you get enough on there. And then, okay, next question. These are wet pellets. And by the way, we're in Memphis, Tennessee, which is an incredibly humid area. We are as humid here as in many parts of Africa. And you have to dry these pellets immediately, right, using not incredible heats, right? Again, you can't put it in an oven to dry it out. And you have a very small amount of time before the thing just turns to mush, right? So we had to create a new system by which it's more of an HVAC system than it is a heater, because it's actually sucking the moisture out of the air and therefore out of the pellets. So this is, you're kind of getting to the point of saying find a way or make one, right? It's
Right.
like, okay, look,
Wow.
we knew these mice were the targets, okay? We knew that was it. And so we had to figure these things out. And I keep saying I really mean our VP of manufacturing, Dr. Steve Zatechka. I mean, our chief scientific officer, Julika van Oosterwijk, Dr. van Oosterwijk. And I mean, actually our VP of regulatory too, Dr. Russell John Brook, because I had to figure out a way to regulate all this stuff,
Right.
in the medical space, all of which took all this different translation that I'm talking about, all this negotiation, all these redefinitions of what these terms are in order to make this happen. At the end of the day, we created and delivered a vaccine to your backyard, to your home, okay? That's never been done before. That's really, philosophically and distribution-wise, a game changer in public health. It changes the whole sphere of getting these vaccines over. But again, to your point earlier, right? What are the criteria you have to set, and how are you going to have to get there? In our case, with this vaccine that I'm talking about, we had to basically build everything from scratch. And we had to fail a lot, and we had to rework things a lot, and it took a lot longer than we thought. But we still, we're on market, 19 states and DC with this product.
So did you say 70 or 75% of Lyme disease cases come from your backyard?
That is correct. That's right. And,
wow, I had no idea.
Yeah, it's terrible. It's terrible. And, people will get it in the park, of course,
Right.
go on a hike, go biking, those sort of things. Of course they do. But the majority of it is. And that's just because we walk out in the backyard with our dog, but we don't spray ourselves. We'll go to the parks most of the time. We'll spray ourselves. That's smart. But we don't do it every day, when our dogs are running back and forth, right?
Yeah.
I mean, they just give an example, But that is why I think predominantly it's there.
Okay. And so the pellets then treat the mice, and then the mice get bitten by the ticks and then don't carry then the Lyme disease. It prevents it at that point. Can you walk us through the process from understanding digestive systems to designing substrates and delivery vehicles to ensuring vaccines reach the right place in the gut?
Right. And again, I don't want to make it sound like I figured this out. So much of this has been with some of the inventors of the base vaccine. There was Maria Gomes-Selecki, who's a professor at the University of Tennessee Health Science Center. She's a veterinarian and a microbiologist. And then this was then expanded enormously by our team, Julika van Oosterwijk up front. And she would go, look, a mouse is not a dog, right? A mouse is a herbivore. A dog is omnivore, I guess. A cat's a carnivore, by the way. Their stomachs look completely different. The proteins, the enzymes, those sort of things. It's a completely different chemical environment. And so she had to create a chemical matrix along with our VP of manufacturing, Steve Zatechka, that would allow that dead protein on that substrate, the pellet in this case, in this product, through each step in that animal's digestive tract. Okay, you start with the mouse, get to the esophagus, you get through the stomach, and then you get to that part of the animal's body where this really works, which is the top part of their intestine system. That's where these little proteins speak to the animal's body and say, make antibodies, make antibodies, make antibodies. So they had to create a chemical matrix that would degrade slowly enough in each of those environments, right, and at the right amount of time in order to deliver that payload into the right part of the animal, right, into that one time. It's all supply chain, actually. It's really what it is. And we'll talk about that more in a minute, I'm sure. But, they had to figure out what that math was. And so it was actually kind of cool when you go into the laboratory. She has a series of beakers set up and, jars as she's taking these pellets and putting it in each of these sections. And each of these sections have a certain type of acid in them and enzymes and proteins. And just a mixture that she made based on the physiology of that animal. Now, she's made this successful in a chicken, and she's made it successful actually in ferrets and even a goat, if you can imagine that. A goat, a ruminant has 4 stomachs. It's the first part, the rumen, is actually a methane factory. It's a really, really harsh environment. But she's been able to manipulate this in this way to make very good, successful approaches on this. And I think this is why our approach has actually worked where a lot of people don't. They think it's just throw something heavy enough in the animal and it'll be okay. But really, an animal's body is made to shred things, to go through their GI tract. That's what evolution has done for it. And so you have to take that into account and give there some mechanism in order to do that.
Yeah. Yeah, that's super fascinating. And you've built an impressive IP portfolio from antimicrobial peptide vectors to universal tick antigens. How does intellectual property strategy fit into your innovation model?
It's a primary issue. It really is, because biotechnology, a huge part of the valuation is on those collected intellectual properties. Now, to be clear, there's also probably even more importantly company know-how, what's in their brains, what are they capable of doing? And then there's what you actually publish, right, in a paper, for example, or take to a conference. And then there's actually the pieces that are inside the patent itself, which is mostly just the claims of what it is you're able to do and the proof that you've done it. So when we look at a patent, we have to think a lot of different questions. We got to think, is this patent worth it? Because it's a lot of work. It's a lot of money, especially if you're a smaller company where resources are very important. Folks like Apple will just churn them out. You know what I mean? They just pay and pay and pay, and they have thousands of patents. But what they're doing, and what we're still doing in our own smaller way, is creating what we call a minefield. Okay, we're creating a distributed network of this intellectual property that every time someone might want to try to do something similar to what we have done, they run into that minefield, right? And they say, oh gosh, we can't do that. We have to try to find another way. And there's always different ways. Find a way or make one. There's always a different way. But in our case, we can protect our little piece of it, so that the money and time and all the effort we put into it can't just be stolen, if that makes sense. Sometimes we were competing against ourselves, right? We create something new and we look at it and we're like, actually, no, that actually is not far enough away from our other patent. So it's actually covered by another patent. Sometimes we'll take one product or one solution and we'll make multiple patents out of it. That whole system that I just talked to you about with the chemical matrix and the spray on and all that stuff, that has turned into multiple patents. One is actually the composition. What is the chemical matrix? What's going in there? How do you do those things? And it doesn't just cover a pellet. It covers powders, which we can make. It can cover amalgams, which we can make. You can cover chewables, which we can make. But then the other side of that is the actual physical process of spraying it on, for example, and that's a method. So composition patent, method patents. And so we have to really sit down and chart all those out, and say, okay, here's this minefield, here's this mine, here's this mine, here's this mine, and see if the new thing we're talking about to get patented, either A, it makes sense from a business case, or B, is not already covered inside the minefield. And hopefully, as you go along, you'll do two things. You'll find more and more stuff that you can't do because it's already protected, but you'll also be innovative enough to keep filling out those holes and even broadening, the scope of the minefield, because of the new stuff that you're doing down the road. And I think we've been successful with that. I think we've done a good job on that. We have some terrific representation working with us, and we do a ton of the patent writing ourselves, to start. And then moving forward with that.
And earlier you mentioned your process that was similar to manufacturing in terms of supply chain.
Sure.
What parallels do you see between biotech innovation and industrial engineering?
Yeah, our CEO, Mason Kaufman, was one of the earliest Federal Express pioneers, what we know now as FedEx. And he met Fred Smith, the founder, who regrettably just passed away here in Memphis, during an MBA program at the University of Memphis. And Fred came out and talked to everyone. And as Mason likes to say, I just got an MBA program. I thought I'd go work for him. It would fail. Then I'd go work for Kmart. And that would be my career. Instead, what happened was for the next 15 years, he walked in as one of the first couple of hundred FedEx employees, and he left when there were like 300,000 employees. And then he went on to found and sell a few more of his own logistics companies. And then he, came into US Biologic, and we're very lucky that he joined us as one of our co-founders. So we call ourselves, at the end of the day, a delivery company. We are agnostic to an animal. We are agnostic to a disease, and we are agnostic to, the antigen, the actual vaccine, and other biologics as well. So, from our perspective, then it's all about the supply chain of that disease, right? And when does it start? How does it start? How fast? What are the different elements that have to come into play? How is it that each of those elements are going to line up in enough time for that disease to be delivered perfectly, right? In order to infect that next creature, right? But then we say, let's create a supply chain that's responsive to that. And we look at it from a perspective of manufacturing like anyone else does, really. Where are the ingredients? When do we need them? How long does it take to make? How long does it take to go through our quality and our regulatory processes and then our distribution processes? And it's in that final piece that it all really comes together because we have to get it into backyards. In our case, veterinarians don't go in backyards, right? Much less the millions of homes that are in the Northeast and Midwest. So that's where we work with our distribution partners who are pest management professionals who are in those backyards every day. And we had to create new regulatory pathways for that to happen, right? Because that's never been done before. But at the same time, that's where it all really came together. So from start to finish, it's like, okay, how's the disease delivered? And then how's the prevention delivered? And how do we get there first, right? How do we get the prevention there before the disease gets there and have all these pieces come together? And so every day, everything we talk about is, right time, right place, and make that happen.
Yeah. So out of curiosity, the end of the day, is your target audience the homeowner or is it the pest control provider?
In this case, in this specific product, we have three. The first one is the pest control group, pest management professionals. And what they do is deliver to the homes. So we're B2B, right? We sell to them directly. And then they go to their residential customers. And so we don't go B2C. We don't go to those customers. We don't interfere.
Right.
That's their relationship, right?
Yeah.
How they do things. We have commercial where we will go to, soccer fields, campgrounds, or summer camps, I guess, golf courses. It works a little differently. Sometimes they already have a pest management professional who does the work for them. Sometimes they have qualified people who are capable of doing that on their own staff. And then we have public, which are your public parks, your Department of Defense installations, and those sort of things. And then in those cases, both the commercial and the public, we sell directly to that entity and deliver it to that entity, and then they are able to apply it in the ways that they do. And again, with the public entities, mostly they use pest management professionals. So they're really our partners in all three places, but we are doing it in different ways, and the invoices go to different places.
Yeah. I'm just curious because it is with the outbreak of Lyme disease, like you're mentioning, and just the increase in cases as well as where they get it. Most people get it in their backyards. They are educating the public at large. Is probably a.
Okay, let's talk supply chain and manufacturing. You have to supply education, and you have to create the information and get it to the right people at the right time. That's not easy. That's not easy. It's taken a lot of work. Took us a lot of time. We failed several times to how to figure that out, and we're at the point where I think we figured out how to communicate. And so that's where it's a great product. I feel like it has a great future. Just needs to have that final push.
Disease prevention. It's not just a healthcare issue. It's also an economic and industrial challenge.
It is.
So how do you see U.S. biologics work impacting industries outside of healthcare?
So, that's a great question because it's not just U.S. Biologic. It's far bigger than any one company. 75% of all emerging infectious diseases come from animals. 75%. 2.7 million people die every year from an animal-borne disease. Okay.
Is that worldwide or U.S.?
Worldwide. Yeah, worldwide. It's every 12 seconds someone's dying. All right, so we've been talking for about 40 minutes. 5 people every minute, right? So far, how many? Hundreds of people have died just from the time we've been talking. These are massive, massive issues. So I think that an approach of saying let's go and prevent these diseases at the animal source will have a pretty big impact on society. And the reason I say that is COVID. Millions of people died and trillions of economic dollars lost that we're still dealing with, and society shut down. you know,
Right.
and
Yeah. Huge
and
impact.
I don't know, I don't care what you think about where COVID came from, a lab or an animal. I know it got to humans through an animal,
Hmm.
right? At the end of the day, that was the final last mile of delivery was that animal. You know, I think that if we don't start seriously addressing these diseases at the actual source of the disease, we're just going to have more and more problems. People sometimes aren't aware of where seasonal flu happens. It's a lot of birds and it's a lot of pigs. You know, you have this virus like replicating and mutating and going back and forth between these animals, and then there's a crossover into humans. That's simplification of the whole system, but that's a lot of what's happening. You know, obviously we've had things that we all know about, malaria and that sort of thing, with the mosquitoes and those issues. Plus West Nile and all the other ones, and you just hear the diseases, you know, popping up all the time. So I think from a societal standpoint, what an approach like US Biologic has is really trying to protect the underpinnings of the way society works, right? Which is a human being and its health and people being able to do stuff and buy stuff and use stuff. And that's what we're doing. We're trying to find a way to keep that going.
Right. So animal health directly impacts, like you're saying, people,
Yeah.
and it affects agriculture, food industries. How important is cross-sector collaboration in tackling these big challenges?
Yeah, we have to figure out a way to translate what we do to each other and talk about it. I mean, we really do. It's, you know, there's a One Health movement, is what it's called, and it's far more important in international settings than it is the U.S., even though there are groups who are doing a great job trying to promote it. But the idea is pretty straightforward. Animals and humans and the environment mean something to each other. And we all have to work together if we're ever going to have more stability and less disease and less destruction. And so, on one level, it's, yeah, we have to work with vets and doctors, you know, I mean, it's pretty straightforward. But on a market level, you have to have companies that are able to create products that actually stop the transmission of these diseases between the two creatures. But then at the same time, you have to have a regulatory piece. You know, our Lyme vaccine in the mice, we do not claim it stops anything in humans. We stop Borrelia, transmission of Borrelia or Lyme disease in mice. You know, that's the claim for the vaccination of Lyme or against Borrelia burgdorferi or Lyme disease. It's the actual quote. We all know what we're doing it for, right? I mean, mice
Right.
don't get Lyme disease. You know, we know the end game of this, but at the same time, you know, that's just not our claim, and we won't make one like that. We have to keep working on that. You know, we have
Right.
to keep finding ways that our products will have direct impact into human health and the direct causation of that. And it's not an easy thing to look at, right? And we have to keep finding a way to make one in order to show that. And we then, on the final side of it, we have to make it profitable. We have to have companies be able to make money on it for a private solution, because the government can't do all of it, right? It can certainly provide instigatory capital and policy, but at the end of the day, it has to be a private solution, I think, in order to really make a big difference. And so we're going to have to cross over not just the animals and the humans. It's always still about the regulatory and the money, and it's about the science, you know, and then obviously all the crazy manufacturing things that I talked about earlier that we had to come up with to address this in a totally different way, you know. And that's also very exciting about being in the field. You know, it's pretty cool because you just keep saying that's the end goal, and we're going to have to figure something out that hasn't been done before, and you're going to have to go through the meetings where everybody thinks you're kind of crazy and don't understand the world. But then the more and more conversations you have as they come in further and further and understand more and more the language you're telling them, it actually changes things and it turns into
Right.
cool stuff.
Yeah, the messaging, the communication, and the more people understand what's happening and what the implications are for people, you know,
Yeah,
the
I think
more they'll
so.
see the value in
Yeah,
what you're
I
doing
think
and
so.
the outcomes. What role do you see manufacturing innovation, like from automation, scaling, or sustainability, playing in the future of biotech and global health?
I mean, that's such a big question, and there's so much evidence of why manufacturing has such a profound impact on the human race in general, right? Be it from food to cars to planes, you know, just the things that we make through those kinds of manufacturing pieces. I'm not qualified to give that full answer, right? I can tell you what I think it can do in medicine in the sense that we can live in a bit more harmonious state with our world. we as a species, at a very fundamental level. And if that's the case, then hopefully that will mean we can have a lot more in the way of not just less sick people, but more people will be less sick, by which I mean bigger populations of which. People
Right.
in areas that have traditionally been really hit hard by these kinds of diseases, if they have less, then one would hope that they will have more of an opportunity to develop more and to gain more resources and build more of their own infrastructure. At which point you can see a lot of different parts of the world really being able to emerge and positively affect everyone else on a holistic level, if that makes sense. And so just to give the example, you mentioned the word modular at the very beginning, and that's exactly right. This spray equipment and this HVAC system that we're using, it's not too expensive now that we've developed it. It's not hard, it's not, particularly large, right? I mean, we didn't have the space or the time or the money to do any of those things. We had to make a throughput of 10,000 pellets per minute. And at a very, very high cost, low cost of goods. We didn't get 25 cents per pellet. That didn't work. That couldn't be our criterion, right? So we made it in such a way that we can actually recreate that in a lot of different places. The modularity of it and the movability of it and the, I don't call it simplicity of it because they're very sophisticated machines. But on the other hand, they don't have as many moving parts as other things do, and they can work in a lot of different environments with a lot less water and electrical necessity, right? And so that's, I think, where manufacturing could have the biggest piece, is just being able to deliver, create and deliver these things more locally so that they can get to more people and what were before very difficult places to reach.
Right. Yeah, just the wider reach and
Yeah.
meet. Are you distributing internationally or just US based right now?
Animal-borne diseases are global, so that means we're gonna have to look a long time at all those different pieces. And
Yeah.
so, no, absolutely, unquestionably, it's just a matter of the different animals and the different types of diseases. Europe, Lyme disease, the biology of it, the bug is a bit different, right? The animals, even in this country, in California, you have some rats involved, you have some chipmunks involved. So you have to look at the different ways that you deliver these pellets to them, and one thing we didn't really talk about was these timed application stations that we had to create. Our pest management professional industry folks, they said we only go into backyards 4 times a year. And we say, well, you have to apply these, vaccines year round to be most effective, right? Because you have multiple broods of mice and they're eating all year. And they said, well, figure that out. And so what we did was create this timed application station that made a small controlled amount of the pellets available every couple of weeks. And it kept it very safe and secure, kept it away from water and snow and those sort of things. Okay, that's a cool piece of technology, right? And it's just as cool in my opinion, and the manufacturing process is just as cool, created with our partners called Pentar in Alabama. And okay, that's fine. What about chipmunk? They're up in they're up in a tree. Okay, well now we're going to have to figure out how to put one of those up on a tree, right? I mean, before it's on a paver stone drilled in, put into your corner of your backyard, way in the back, away from your house, right? Okay, well, let's get one in your tree now. So these are just the challenges that we will face every time we go look at a different disease in a different species. Poultry, I mentioned, it's a powder. It's a simple powder. We had to make it a powder because the producers don't need a lot of work to put stuff in their food. Everything's very vertically integrated in poultry feed, right? And there's very little room for time or for any additional costs. No room. Let me put it that way. There's negative room, in those areas. So we had to find a way in order to deliver it in such a simple way that it actually could get there. Now, it could also be through their water systems, right, at the end of the day. So that's the sort of thing we think about. So are we going to go international? Yeah, we have to. We have to if we're going to have an impact on disease globally. It has to be a piece of it.
And looking ahead, what are the biggest opportunities you see for disease prevention technologies in the next 5 to 10 years?
I think one of the biggest ones actually tied a little bit over on the high tech side. The artificial intelligence piece that we're beginning to finally understand a little bit more, we have a biggest opportunity for rapid response than we ever have. Even during COVID, when you saw the Apollo mission of getting a vaccine out there within, 90 days, 6 months, we didn't really have the capability of it even then because the AI really wasn't there to help us. So imagine a vision in which you could pick up a mouse and you go, okay, this mouse has this type of COVID in it, or deer, because it's really prevalent in those populations, mice and deer. People, that's a good thing to remember. It hasn't gone to humans yet, but it keeps circulating just like seasonal flu between those species. It's going to jump back over to human. So what if we picked up a mouse and we said, okay, it has COVID. It has a very specific type of COVID to this specific region of the country, okay? We need to be able to put that into a machine, a software machine. And that machine has to be able to say, here's the specific type, and here are what we believe to be a series of antigens that will be responsive. So instead of thousands, let's take 10, okay? And then from there, that thing has to be able to, the machine has to be able to show us a pathway. Can we manufacture it at scale at good cost of goods? Is there a regulatory pathway that will work, right? And then from there, is there an actual feasibility model for money? And then from there, is there a distribution network? Now, the machine's not doing all that for us, but it can give us a heck of a good guidebook to make sure that we're going to get there in a lot quicker, right? And it's something where, if just give regulatory example, if the AI machine can say, look, here's all the regulations, here are examples in the past. Here's all our own products and the own pathway. Here's everything that's happening in every single state. These things that usually would take months to research and negotiate, if you can come out with a report within seconds that is ready to be reread, checked, reworked, and then submitted, you just took months and months and months away from this whole project and made it a lot faster. AI is going to the point of where we don't need animal models anymore. And think how cool that is, right? I mean, getting cool. Antibody response in a mouse, months. To get a challenge trial, add months.
Wow.
Huge facilities, huge amount of regulatory work locally, but with the USDA. Okay, let's instead say, let's put this type of antigen into this type of creature, and you'll get a reliable simulation of how that antigen is going to respond in that creature. Imagine how much we're saving them, and how much time and how much money. We'll still have to validate it. I mean, we'll still have to do those things, but at least you're getting rid of so much of the guesswork and all the trial and error. And I really think that's the big opportunity, is really when you're seeing the rapid response of that. And I'm only looking at biotech, right? It'll be different in different fields.
Yeah.
But I'm sure there's big applications there too. But in this case, I'm really excited about seeing that machine happen.
So it's saving time, effort, money when it comes to research and development, is what I'm hearing.
Yeah, and by the way, just to be clear though, we still need to be able to manufacture this thing. We still have to be able to have the machines, the know-how, the chemicals, the availability of the different ingredients, most certainly, which is in and of itself always a huge challenge, especially in this country. But then at the same time, we still have to have a distribution network. We still have to have that last mile where individuals will be able to go out and get it to where those animals are, right? This is not taken away in any sense from the manufacturing, the physical world. It's simply that, this new technology, this new software technology can help guide and save a lot of time and money.
Yeah, that's fascinating and exciting.
It is. It's cool.
Yeah. What advice would you give leaders, whether in biotech, manufacturing, or industrial sectors, who are looking to take bold, transformative steps in their industries?
Yeah. You're wrong. It's just to start this conversation. You're wrong. You don't have it right. You don't know what you're doing. You're going to make a ton of mistakes. Just let's get all on the table right now. It's like a financial projection. I don't know if it's going to be higher or lower, but it won't be what I just gave you. I mean, we just accept that up front. And where that means that you're going to come from a standpoint of saying, this is about making mistakes and learning from those mistakes and moving forward, and doing every little thing we can to prevent the mistakes. We're not just accepting the fact that crazy things will happen, and these mistakes won't happen because of a lack of diligence or a lack of effort or a lack of being careful. It's just, we don't know what we're doing. And that's the essence of what innovation is,
Yeah.
I mean, Edison, you hear the trope all the time about, I didn't make 1,000 mistakes on my light bulb. I just found 1,000 ways it didn't work. I just made those discoveries, and that's actually kind of the right idea of it. And that's very, very frustrating to some people who are not in this business of making new things. They see the failure, right? And they say, well, there's incompetence involved, or I wouldn't have done it this way, or, this is too risky. And okay, I get that. And that's their job, and that's why they're employees at big established companies, and they're doing a great job there. They're, making good things. It's just they don't have to create anything. They have to keep the system going. Yeah. On this side, though, when this is what you're doing, you find a way or you make one. And it's just, you just have to accept the fact that you're wrong. You don't know what you're doing. Just keep making mistakes and keep moving forward every day.
Right. Absolutely. Well, not being biased. I mean, I think that was one of the biggest takeaways from my PhD, education as well. It's like, that is super important. It's to remain unbiased. It's not having to be right, not trying to be right. It's trying to identify the solutions, what works, the truth, not being right.
Yeah. Every time you got in front of your committee, right? Yeah. Okay, well, we're going to go back and figure it out. I'll listen to what you say. I'll modulate, and I'll try to find another way.
Because otherwise, it's just ego, and ego just gets in the way of everything. So
it's a humbling business.
Yeah. At least with my pursuit.
Yeah, you have to both somehow have the faith in yourself, but at the same time feel worthless and incapable at the same time. And it's a little bit of a weird juxtaposition for a lot of folks, but it also can create some very powerful things if you just have the willpower to keep going.
Absolutely, right, because it's not about being right, it's about finding the solutions and persevering. And,
it's about being effective.
Being effective at the end of the day. And maybe it's not what you thought initially. Maybe it's a better, outcome or than you thought possible. So,
That's right.
So finally, Chris, if you could leave our audience of industrial and manufacturing and business leaders with one message about leading transformative change, what would that be?
I think more than anything is, make a choice, right? Make a choice. Are you doing this or not? And don't make that choice lightly. Look at your market, look at the technology, look at how much money and time you have in order to develop something. Look at your mission, look at your team members. But make a choice. Don't say, well, we're going to try 3 different pathways, right? Unless you have the resources to actually do a full-blooded program in all 3. Make a choice, go deep dive, and then take it down the road. Have the discipline to see what's working, and then have the discipline to see what's not working. And then keep going. And as long as it makes sense, find a way or make one. And but if it's not, it doesn't. And you just have to, unfortunately, admit it that it wasn't happening at this time of your life and keep moving forward into the next solution. So as long as you get to that final goal.
Yeah, well, valuable insight. Well, Chris, thank you for sharing everything that you've shared with us today. It's been a fascinating conversation, learning about the groundbreaking work happening at US Biologic. It's super inspiring to see how science, engineering, and manufacturing come together, and not only to innovate in biotech, but reshape what's possible for a global disease prevention.
And logistics and business.
Yeah, absolutely. So how can our listeners learn more about US Biologic?
Well, I guess we have a website, usbiologic.com. Come over and take a look.
Okay,
usbiologic.com.
All right. So for those listening, don't forget to subscribe to Industry Ignited so you'll never miss an episode. And until next time, stay bold, stay curious, and keep igniting industry.